Welcome to your IELTS listening practice from Spinta.org. This is a mini test designed to help you practice a specific section of the exam and improve your confidence. The recording will be played one time only, just like in the official test. Let's begin.
Welcome everyone to today's lecture, where we will explore a fascinating yet complex topic within the field of neuroscience: addiction neural pathways. Today, our focus will be primarily on the hijacking of the brain's reward system in relation to addiction and the implications for treatment. This is an essential area of study, as understanding the neural mechanisms behind addiction can significantly impact therapeutic approaches. First, let us consider what addiction actually entails. Addiction is characterized by a compulsive engagement in rewarding stimuli, despite adverse consequences. The brain's reward circuitry plays a primary role in this behavior. Importantly, the neurotransmitter dopamine is fundamental to the experience of pleasure and reinforcement, and it is the pathway through which many substances, including drugs and alcohol, exert their effects. To understand the neural pathways involved in addiction, we primarily refer to the mesolimbic pathway, which is a key component of the brain's reward system. This pathway involves several regions, including the ventral tegmental area, the nucleus accumbens, and the prefrontal cortex. The hijacking of this reward system by addictive substances often leads to abnormal dopamine release patterns, reinforcing the cycle of addiction. Let's dive a little deeper into the functions of the primary neurotransmitter associated with addiction, dopamine. This neurotransmitter plays a vital role in transmitting signals that create feelings of pleasure and satisfaction. When someone engages in an activity that brings pleasure, such as eating, socializing, or using substances, dopamine pathways become activated, teaching the brain to repeat the behavior. However, addictive substances can lead to a dramatically heightened response. For instance, when an individual uses cocaine, it leads to excessive dopamine levels in the synaptic cleft, because cocaine blocks dopamine reuptake. Thus, there is prolonged activation of dopamine receptors, amplifying the feelings of euphoria. This rapid and intense surge is a stark contrast to the slower, natural release of dopamine during ordinary activities. This brings us to a vital aspect of our discussion: tolerance. As the brain adapts to the higher levels of dopamine, it starts to require more of the substance to achieve the same level of pleasure. Consequently, this leads to an increase in the quantity consumed. In this context, we can see the connection between increasing consumption and biological changes, reflecting the brain's adaptation, a concept we understand under the umbrella of addiction. In this lecture, we also need to analyze behavioral symptoms of addiction. These behaviors often include cravings, loss of control, and continued use despite harmful effects, therefore categorizing addiction as a chronic brain disorder. Importantly, the brain regions that are most impacted include the amygdala, the insula, and the prefrontal cortex. Each of these regions contributes uniquely to the withdrawal symptoms and the compulsiveness of addiction. Additionally, it is essential to consider treatment implications stemming from our understanding of addiction neural pathways. Various treatment models exist, each tailored to counteract the neurobiological changes that addiction creates. One widely utilized approach is cognitive behavioral therapy, or CBT. Cognitive behavioral therapy targets dysfunctional thought patterns and behaviors associated with addiction. It aims to assist individuals in developing coping strategies that can help manage cravings and avoid relapse. CBT has been validated through research and has shown significant efficacy across multiple substance use disorders. Moreover, pharmacological interventions also play a critical role. Medications can be used to influence the neurochemical imbalances or to ease withdrawal symptoms. For instance, medications that modulate the effects of dopamine can reduce cravings for drugs such as heroin and cocaine. Thus, integrating both therapy and medication can yield a more effective treatment outcome. Now, let's examine a real-world example. In recent years, there has been an emergence of medical professionals utilizing a combination of medication-assisted treatment alongside behavioral therapies. In this integrated approach, individuals struggling with opioid addiction are administered medications such as methadone or buprenorphine. These medications act on the same receptors as the opioids, thereby minimizing withdrawal symptoms, and when paired with behavioral therapies, they enhance treatment efficacy. Another notable example involves the use of naltrexone, which blocks the effects of opioids at the receptor level. It has been successful for patients seeking to regain control and resist cravings. Studies have suggested that naltrexone, in conjunction with therapies like motivational enhancement therapy, can help manage the pathways associated with addiction. As we contemplate the implications of addiction treatment, it is critical to consider the importance of continued research. The field of addiction neuroscience is evolving rapidly, and ongoing studies are examining the genetic components of addiction as well as the environmental factors that contribute to susceptibility. For instance, findings have emerged indicating that genetic predisposition can alter how dopamine pathways operate in response to addictive substances. In conclusion, our understanding of addiction neural pathways and the hijacking of the reward system has profound implications for treatment. By appreciating the complexity of these neurological changes, we can better inform therapeutic approaches that encapsulate both behavioral and pharmacological strategies. With the knowledge that addiction alters fundamental brain systems, we are empowered to develop targeted interventions that can lead to successful recovery. The journey of addiction is nuanced, involving intricate interplay among neurotransmitters, brain structures, and behavioral patterns. Thus, it is essential that we continue to advocate for an integrated approach to treatment that embraces both the neurobiological and psychological dimensions of addiction.
You have now completed the practice test. When you are ready for a full exam experience, visit us at Spinta.org. There you will find complete mock tests for all 4 skills: listening, reading, writing, and speaking. Our platform provides instant AI feedback for your speaking and writing tasks, along with an accurate prediction of your band score. Take control of your preparation at Spinta.org.